Maybe you watched CBS News this morning and were shocked when you were advised not to take vitamin D. Well, it surprised Local 12's Paula Toti, and she went digging for answers.
When it comes to supplements, vitamin D is the second most popular in the U.S. behind multivitamins. Our milk and juice is fortified with vitamin D. This morning, Dr. David Agus, who reports for CBS, was referring to a new study from JAMA Internal Medicine that says it doesn't help with lowering high blood pressure and may open the door to other health risks.
The U.S. Preventive Task Force, the most conservative group in the country, says nobody in the country should be tested now or taking vitamin D. 75% of Caucasians and 97% of African Americans are, quote, low in D. So I think, and the community thinks, we now have to reassess what is normal. Nobody should be taking it at the present time in a normal individual.
Well, that isn't sitting well with folks at Nye's Pharmacy in Independence or Dr. Kim Sanders, who has a health and wellness practice there.
Paula, I was quite shocked by the report this morning by Dr. Agus. I use vitamin D in myself, my family, and my patients.
She says a study on blood pressure was one study and can point to others that show the vitamin is good for stroke and cardiovascular issues. More importantly, she points to the benefits for preventing bone fractures.
I believe that we see a higher rate of fractures in kids and adults in this area. And I often wonder to myself, is it due to lack of vitamin D for about 6 months out of the year in our area? I think in the Midwest, vitamin D deficiency is an epidemic.
And Dr. Sanders says the benefits of D don't stop there.
For the immune system, for the flu prevention in the winter. I use it for cancer prevention. There are many studies for breast cancer prevention and colon cancer prevention.
Bottom line, don't toss the D.
Dr. Sanders told me people prone to kidney stones may need to be careful with high doses of vitamin D, but she says she has never seen a case of vitamin D toxicity. She says getting it in a multiple with your calcium and even in a separate supplement form, all of those together, she does not see as excessive. Cammie?
All right, Paula, thank you. And the doctor we spoke to today does recommend getting tested for vitamin D on a regular basis. Speak to your own doctor, of course. It's something that can usually be done and paid for with an annual